Hello viewers, the remedy that we are going to discuss today is the queen of poisons. And with homeopathic potentization, this queen of poisons is transformed into a fairy godmother. The blessings of this fairy godmother helps us to combat with difficult situations like panic attacks or terror that one experiences after having a fright or after having a sudden shock. It is also useful where there is unreasonable, unaccountable fear of death, fear of crowds, fear of crossing roads, fear of narrow places. Guess what? Yes, you got me right. We are talking about Aconitum Napellus, or which is also called as monk's hood or wolf's bane. The remedy was proved by Dr. Hahnemann. Tincture was made from the whole plant with the roots when beginning to flower. The plant belongs to the natural order of Ranunculaceae and is found abundantly growing along the mountainous regions of Europe and Russia. And it has a chief action upon the cardiopulmonary system and the muscular system. Physical and mental restlessness, great fear, anxiety and worry are the characteristic symptoms that accompany every ailment, however trivial. Ailments come on from fright, anger, silent grief and sometimes even from excessive joy. The patient may give a history of exposure to very cold weather, a draught of cold air or checked perspiration or very hot climate. It is the first remedy in inflammation. In fact, the most acute of all the remedies. Aconitum causes only functional disturbances and does not produce tissue changes. Its sphere of action is in the beginning of an acute disease. It is indicated in hyperemia and congestion and not after exudation has set in. Acute, sudden and violent invasion with fever calls for this remedy. Many a times one comes across strong, robust looking patients who suddenly come down with fever, severe headache, a full pounding pulse, flushed face, hot dry skin with great nervous excitability. On this acute picture, you cannot come to a specific diagnosis. You cannot decide whether the patient has an ordinary chill which will subside in no time or whether it is going on to a definite disease condition like ASOM, tonsillitis, pneumonia, appendicitis, etc. Here comes the role of aconite in the first 36 hours of an acute illness. In later stages, one will not get response by giving aconite, nor will the aconite indication remain. The nervous excitability of aconite is characterized by physical and mental restlessness, sudden and great sinking of strength. The patient is in an anguish, tossing about besides himself. There is insomnia, nightmares. He is unable to concentrate and indifferent to everything, including loved ones. There is great irritability, sometimes to the level of delirium, which is characterized by unhappiness, worry, fear, raving. Aconite is indicated for excitable persons and not for calm ones. Everything excites him. He cannot take anything easy. Even in his normal state, aconite is hurried. His speech is hasty, jerky, excited. His sensitive nervous system can also make him cheerful, laughing, singing, dancing. But although he is mild and timid, he is suspicious. He is intolerant to contradiction. He cannot take a joke and is offended easily and takes everything in bad part. So here too a slightest trifle can change his cheerfulness to anxiety. Aggravation, conversation from alternate attacks of opposite states of humor, a fitful mood. Because of this inbuilt nervous excitability of his system, the patient feels the violence of his sickness. He becomes extremely sensitive to all sensation. He becomes intolerant to pain. He is moaning, groaning, weaning, howling when he is in fever or in pain. His entire behavior appears foolish and weird. He doesn't know where to go, what to do. His mind is ruled over by tremendous anxiety and fear. So, during sickness, the person who otherwise appears normal becomes intensely restless, panicky, and nervous. An acute, sudden, intense panic reaction. This panic is a combination of his clairvoyance and an intense fear of death. The fear is so overwhelming that he feels that this state of his must mean death. He is suddenly stricken by despair and he becomes doubtful of his recovery. He seeks a positive light from those around him, which makes him hopeful. Thus, he becomes magnetized and attached to these people. Now, let me tell you that this nervous excitability is present in a number of other remedies like Staphysagria, Chamomilla, Nux vomica, Coffea, Graphitis, Argentum nitricum, and many more. But the characteristic feature of aconite is that this overwhelming reaction of acute tossing about in impatience and anguish, which comes on suddenly, also disappears as suddenly as it had come, without leaving a trace behind. The fearful, excited state passes off and a normal state of cheerfulness re-emerges. It is this alternating cheerfulness of aconite which differentiates it from other remedies. Murphy says aconite is a drug with strongly marked causations. Fear, fright, trauma, surgical operations, the effects of these will be met in large majority of cases by aconite. The timely administration of aconite will ward off serious results. Not taken care of, these events may be brushed off from conscious memory, but at the subconscious level, the consequences may be long lasting, especially in nervous excitable persons. Long lasting consequences may be in form of weakening of our immune system, effects on the cardiovascular system, effects on the gastrointestinal system, memory, muscles, brain processing, impact upon general reactivity to stimuli. The brain perceives unreal threats to its survival and evokes a state of tension. Tension in the systemic blood vessels, tension in the musculature, tension within the involuntary muscles, tension within the semi-involuntary muscles and apparatus of respiration, tension within the special senses with heightened sensations. Thus, the role of aconite doesn't stay limited to acute diseases alone, but is indicated in all chronic conditions where tension is the keynote. Therefore, it can be indicated in a number of conditions like asthma, bronchitis, arrhythmias, ischemic heart disease, irritable bowel syndrome, dyspepsias, peptic disease, dysenteries, diarrheas, lumbago, fibromyalgias, myositis, dysmenorrhea, infertility, cluster headaches, migraines, convulsions, seizures, and even in vision abnormalities, to say in many other conditions also. In acute conditions, prescribing aconite in lower potencies will only modify the temperature, pain and distress. It will not arrest the progress of disease. If you see the patient the next day, there will be definitely physical signs which are present. So, for a quick control, the selection of potency should be 30 and above. Lower potencies are useful when a patient has an aconite chill without raging temperatures. 3x, 6x potencies will wipe out this irritability. Repetition of higher potency should be done hourly at least for 4 hours, then 2 hourly for at least a period of 12 hours. Administration must be kept until temperature is right down. Correct choice of remedy, potency, dosage and repetition will abort any kind of incipient disease. Even using 30 potency may prolong the time of recovery. Dear friends, if you like the content of this video, don't forget to hit the like button. Do share the video with friends and colleagues. Don't forget to subscribe to my channel and hit the bell button so that you get an immediate notification of my uploaded video. Thanks for watching. See you soon.